Good afternoon and welcome to Protein Power Hour with the Partnership for Food Safety Education. We're extremely excited to kick off the home grilling season, even if we are in this COVID isolation. So we're calling this Home Grilling Alone Together, and we're really glad you're here. My name is Shelley Feist. I'm Executive Director of the nonprofit Partnership for Food Safety Education. I know there's a lot of first-time viewers of our webinars here. I'm so glad to welcome you. We do several webinars during the year, and we're really glad to welcome you into the family and encourage you to always keep your eye on our emails for information about our events. This webinar today is chock full of content. We're going to talk about proteins. We're going to talk about protein foods. We're going to talk about recent data from the CDC, the FoodNet data on pathogens. We have two outstanding expert professionals from poultry and meat scientists, Dr. Ashley Peterson and Dr. KatieRose McCullough. And we'll talk about some recent research on consumer handling of these products, meat and poultry products. We'll have a little bit of time for questions, and then we'll talk about some consumer tools and what else is happening today. Exciting YouTube event happening this afternoon. We're calling Some Like It Hot. So let's go into this. Housekeeping, we love your questions. So please use the question box on the right hand of your screen. And then after the webinar, really help us out by filling out this brief survey you'll get. It allows us to improve what we're offering, and it also lets us get your ideas on topics. CEUs are being offered. I encourage you to use you'll see the attachments function here. I would grab your CEU certificate right here from the sidebar under downloads. You'll get an email follow-up, and then we'll link to the CEU certificates. Or when this event gets put on our events, recorded events tab, you'll be able to get the certificates there. So all those are great ways to get it. We won't be able to answer all your emails about getting the certificate, so please pay attention here on these ways to get it and download it today. We're very happy today to welcome a message from Dr. Mindy Brashears. Many of you who are in food science know about Dr. Brashears, and she has a special message for us today.
Good afternoon. I'm Dr. Mindy Brashears, Undersecretary for Food Safety at the United States Department of Agriculture. Every day, the Food Safety and Inspection Service has inspectors in our meat and poultry processing facilities to make sure that our products are safe and wholesome. I'm sure that each of you are just as dedicated to food safety, and I want to thank you for educating your students, your community, and even your family members in safe food safety practices. Keep up the good work in those areas. During the COVID-19 pandemic, every one of us have had to make adjustments. Social distancing has resulted in an unprecedented number of us having to eat at home. This means that we're cooking more, eating more takeout foods, and handling more leftovers. It's very critical during this time that we are vigilant in delivering the messages for food safety to keep our consumers safe and healthy. At FSIS, we are utilizing materials such as social media, blogging, our meat and poultry hotline, and even video messages like this to communicate to our consumers how to keep their food safe. I am certain the Partnership for Food Safety Education has their own innovative ways to bring these messages to the consumer, but I want to remind you to continue that so we stay safe and healthy during this pandemic. At FSIS, we're starting to think about grilling. It's almost summer, and while it might look a little different, whether you're grilling for one person or a group, make sure that you follow those safe food handling techniques for handling food during grilling. One of those techniques is hand washing. As you know, hand washing has been in the news lately. We have all been talking about hand washing for many years, but we want to continue to emphasize this message when the COVID-19 pandemic ends. Don't forget about that and continue to bring the hand washing message to your consumers, because it's not only a public health issue, it's also a food safety issue. Again, I want to thank you for your diligent efforts to keep our food supply safe and for educating our consumers. Keep up the good work. Thank you and have a great day.
Our protein stars. Well, as you know, there are many protein foods, and we're not able to talk about all of them today, but today you'll hear a little bit more about poultry, beef, pork. On plant-based, we'll just say a little bit about what's going on with plant-based proteins like burgers. We're focusing on things that we commonly see on the grill. So let's get started with their protein stars. A few insights that I've heard about lately that I thought you might be interested in. One, a webinar by a company called Field Agent. They do a lot of like shopper data, and 18% of the consumers they interviewed said they're grilling outside more already. And this was, I believe this is data from last month. So grilling is potentially, particularly in this situation where people are at home, we see there could be a lot of people grilling at home. And we want to prepare you with how to interact with consumers on this important topic of home cooking. Another thing I thought was interesting was seeing the alternative meat sales going up. This was reported by Forbes. So there are more people buying these kinds of products. Frozen products sales are up. So there's a lot of things shifting and going on, and I just want to plant that idea that it is a time of changes in consumption and buying, and we at the partnership will be sharing more of that kind of information with you as health educators as we learn of it. CDC and FoodNet, they release the data every year in the MMWR. So the 2019 data has come out, and it really shows that there is a need for better prevention, and that's part of what Ashley and KatieRose will be talking about today. It appears progress is sort of stalled in controlling some of these common foodborne pathogens, which we are always all working on. And Campylobacter and Salmonella remain the most reported infections in FoodNet. CDC also notes that chicken's an important source of salmonella infections, but we'll also talk about how some of these salmonella types come up across the food chain in different commodities. So this is just to, again, remind us all, if we need the reminder, just how much more cases or infections are linked to Campylobacter and Salmonella, how common they are. It also gives us some information on some of the consumer interventions we all can work on against these common pathogens. So in FoodNet, or in the MMWR, they did publish this great chart. It does compare 2019 to a cluster of prior years and gives you a sense of when they talk about progress being stalled, that we are seeing changes in incidence in all of these pathogens. And it's something to be mindful of and for us to all plan against on our consumer interventions. And then here's some detail about Salmonella. I'm interested in hearing from our speakers today with a little bit more about what's behind some of these changes, with some of these types going down, some of them increasing a lot. And I think they both have perspectives on that that'll be really helpful for us to understand these numbers. So with that, I'm going to introduce Dr. Ashley Peterson. We've worked with Ashley for quite some time. She's with the National Chicken Council. She's Senior Vice President of Scientific and Regulatory Affairs. Ashley, thank you so much for being with us. And if you want to just tell me next, and I will move your slides for you.
That sounds perfect, and thank you so much for the invitation to be with you today. Of course, everybody, when we talk about chicken, we talk about Salmonella, and so do our friends at CDC and FSIS and FDA. And if you look at Salmonella estimates on foodborne pathogens, chicken is number 2 when it comes to the linkage to that particular commodity. Seeded vegetables are number 1 from an attribution standpoint at 17.2%, but then if you go next in line is 14%. And I do want to remind everyone that this is data from 2017. Things change quite rapidly in our industries and all of those commodities across the color spectrum there. And so this report came out at the end of 2019, so that information is about 2 years old, just to put that into perspective. So Shelley, next slide, please. So from a food safety standpoint and from an FSIS regulated standpoint, the chicken industry is regulated using a metric called a performance standard. And that is a tool that the agency uses to evaluate the presence or absence of a pathogen. It is a qualitative measure only. It just says if it's there or if it's not. It doesn't say how much is there. It doesn't say what type of Salmonella is there. And there are ways that the industry, all protein industries can improve those numbers, and that's through proper sanitary dressing procedures in the processing plant, antimicrobial applications in the processing plant, temperature controls, and a lot of other things that we may be doing upstream and on the farm. And so while a performance standard is not enforceable per se, if you as an industry or if you as an establishment are not meeting that performance standard, you have opened yourself up to increased regulatory scrutiny by FSIS. Shelley, next slide. And so in 1996, when the HACCP regulations came to be, performance standards for Salmonella started for whole chickens at 20%. A few years later, as you can see on the slide to the left, the industry had met that performance standard on whole birds. And then in 2011, FSIS redid the performance standard and came up with a new performance standard at 9.8%, and that standard is still in effect today. Next slide. And so, as I said, for whole birds, the performance standard is 9.8% for Salmonella. Turkeys is 7.1, and then in 2016, because the majority of consumers are not getting whole birds anymore, that used to be what a consumer would go buy, would be a whole bird to go home and either make cook a roaster or cut that up and make fried chicken or what have you. And then it became more evident that tray pack products and chicken parts really were leading the charge in what consumers were purchasing. And so the agency, FSIS, switched their focus a little bit so that they also developed performance standards for chicken parts. And in July of 2016, they published and implemented new standards for Salmonella and Campylobacter on chicken parts and comminuted poultry. And by comminuted, I mean ground chicken and turkey. You will notice that I have Campylobacter crossed out, and that could be a whole nother hour-long presentation in explaining why that is. But the short version is the agency is redoing the Campylobacter standard for poultry products right now, and we expect to see that published sometime in 2020. Next slide. So we watch data very closely. USDA publishes their information on a quarterly basis, and if you look at this data, and this goes back until 2006, when the industry was at about 12%. And if you look at that by quarter, you can see that right now, as an industry, we're at a less than 5%. And so I'll just remind you where the orange bar is the current standard for whole chickens at 9.8%. Next slide. And so we don't have quite as much data on chicken parts because, as I mentioned, we didn't have a performance standard that was published until July of 2016. And so the industry was at about 25% on chicken parts back in 2015. And at the end of last year, we were at about 9%. So we're well below the performance standard of 15.4% on chicken parts. Next slide. So I want to talk briefly, switching gears a little bit. There was an outbreak in 2018 and 2019 related to chicken, specifically related to Salmonella Infantis. And if you look at the bar graph on the left-hand side, that shows CDC's epi curve. And again, we had some few case patients that started in January of 2018. The outbreak peaked in August of 2018, and then the last case patients were in July of 2019. And you can also, on the right-hand side on the map, see the distribution of case patients. The majority of them were in Massachusetts, New York, and Pennsylvania. And there were some others scattered, predominantly in Minnesota, Illinois, Ohio, and North Carolina. And New Jersey were second in that they had anywhere from 5 to 9 people in those states. And there were a total of 129 case patients associated with this outbreak. Next slide. So CDC ended their outbreak investigation in February of 2019. As I mentioned, there were 129 cases in 32 states. The age range was less than 1 to 105 with the median age of 42. There were 25 hospitalizations and 1 death associated with this outbreak. And what was really interesting and peculiar about this particular outbreak, which still leaves a lot of us scratching our heads, is that this particular outbreak strain was found in 76 slaughter and processing establishments across the U.S. And though the investigation is closed by the CDC, the industry has been working diligently to not only determine potential sources for this particular serotype, but also mitigation strategies, whether that are different things that we can do on the live side or different intervention strategies that we can implement in the processing plant that we can, again, do our best to reduce Salmonella Infantis. And again, what's interesting about this is that we had really not seen, and FSIS data on the right-hand side, you will see in 2015, out of all of their samples, that they only had 2 that were that specific Infantis pattern, the PFGE pattern of 1080. And that in 2016, there were 7, and then you see the spike in 2018. And the data from 2019 is not complete. So that was information from early in 2019. So we don't have a full year of 2019 PFGE patterns associated with 1080. But just to demonstrate that this really wasn't an issue in the industry in 2015 or 16, and then all of a sudden in 2017 and 18, things changed and it became much more prevalent. Next slide. KatieRose, you are up.
KatieRose. KatieRose is with the North American Meat Institute. We're so glad she's here. These two are like a protein tag team. She's Director of Regulatory and Scientific Affairs. Thank you for being here, KatieRose. I keep wanting to call you Katie. I have a Katie on my staff.
Not a problem. Well, thank you, Shelley, for inviting me here to talk a little bit about the food safety issues we see in the beef and pork industry. And thank you all at the Partnership for Food Safety Education for the work you do. The consumer piece is super, super important for both what Ashley and I do and what industry does. And we really appreciate all the good work that's done. So Dr. Peterson is tough to follow, but I'll do my best and make sure y'all save some good feedback and questions for her. But I want to start off with level setting here. And in 2018 and 2019, you can see the handful of outbreaks that we saw due to meat and poultry products. Quite a few of those related to Salmonella, all the way from, turkey and chicken products and beef products, as well as, processed meat products like deli ham and whatnot. And deli meats, again, with Listeria monocytogenes, as well as a few E. coli outbreaks with ground beef. So you can see that certainly this is something we're still working with in industry, and why food safety is our #1 issue that we work at in both the beef and pork industry. Next slide, please. So if we were to take a step back and say, what are our pathogens of concern for each food commodity? What are we worried about? What is the industry zeroing in on every day to try to really tackle and reduce the number, and eliminate the number of cells in products to keep consumers safe? And if I had to pick our likely culprits or pathogens of concern for beef, we're really worried about Salmonella, as well as Shiga toxin producing E. coli. Those are our 2 biggest concerns that we watch out for and aim at controlling in beef. Salmonella is our biggest concern when we talk about pork products. We'll talk a little bit about more and what's changing with the pork industry later. And further processed meat products, we'll see some concerns with Salmonella and some focus there, but the vast majority of things that we're concerned about when we talk about further processed meat items is Listeria monocytogenes. And great thing about further processed meat items and their food safety is we've really had an excellent safety record as an industry, and Listeria monocytogenes in these further processed or ready-to-eat meat products. And it certainly came off a lot of good science and a lot of hard work from the industry. Next slide, please. So I actually talked a lot about performance standards and how it affects the poultry industry, specifically chickens, but we also deal with performance standards on the red meat side with beef and pork. And so a little backup for those of you who don't know where performance standards came from and why we're so concerned about them as an industry, because this is really the leading metric that the agency kind of uses to tell the industry's temperature of how good of a job or how much work does a plant or an establishment need to do in relation to a specific pathogen when it comes to food safety. So they were originally part of the 1996 pathogen reduction HACCP systems final rule. That was the wonderful gift that gave us these performance standards. And it started saying that no establishment can have a greater prevalence of Salmonella than the baseline. And again, that was the original intention. We've seen other iterations of this, but that's where it started. So first they had to determine what the baseline or average was, and said no one can be above that. Then we saw that these were not only calculated for each species, but we calculated them also for each product category. So if you're talking carcasses or cuts, or if you're talking ground products. One of the most interesting original intent that we see from HACCP implementation is that they said they will require establishments to meet the standard consistently over time as a condition of maintaining an inspection. So again, when this was originally written, it was written to determine, okay, how safe, or how can we determine and take the temperature of these establishments to make sure that they are providing a safe and wholesome product. Since they wrote that in 1996, we'll see that it became way more complicated. Microbiology and food safety, as all of you know, are a lot more difficult than we give it credit for. And so we see how that idea has morphed and changed as we've gained more scientific knowledge. Next slide, please. So we're going to dive deep into beef here. As I'm sure many of you have heard, beef and Salmonella has been a lead focus and a lead concern for us on the red meat side. And so we're going to talk primarily about Salmonella and beef today. Our previous standard that we were working with was separated into 3 different groups: ground beef, cow bull, and steer and heifers. And so the cow bull and steer and heifers, those are 2 different classes, obviously young animals versus older animals, and they did those based on carcass sampling. However, that sampling was suspended in 2011 due to the very, very low amounts of positives that were seen on carcasses, and so the agency decided that wasn't always the best metric, so we stuck with the ground beef performance standard. And how that one worked is, out of 53 samples that were pulled from an establishment, you could not have more than 5, or you should not have more than 5 positives to be considered passing the performance standard. Next slide, please. So this slide is on the proposed beef standards. We are right now in a place where their agency has proposed a new standard for the industry. It goes under a comment period right now. So they released the standard along with a risk assessment and are reviewing comments. So we could still see this change, which is why I have it as a proposed standard, and it changes things quite a bit here. So it takes a 52-week moving window throughout the year, and it takes the most recent 48 samples pulled from a packing plant out of that 52-week moving window. And I'm going to talk about why that 52-week moving window is important later, but it takes that period of time and says the most recent 48 is what they're going to be looking at. If you have 0 to 2 positives, you are considered as meeting the standards. And if you have more than 3 positives, you are considered as not meeting the standards. And they go into a little bit deeper detail that says, you know, they're going to collect more samples at establishments that make more products and less samples at establishments that make next products, which is a little intuitive, but certainly important when you're writing a government regulation. Next slide, please. So we're talking about what type of, what salmonella do we see? What does the overall prevalence look like? If you take FSIS's establishment-specific data sets for their HACCP category of ground beef, or what we call their MT43 sampling program, and you were to chart the prevalence of salmonella for each year across each month, you can see how we get what we refer to as a great seasonality approach. So you see how we tend to see the prevalence start to peak in the warmer months, with it starting to climb in June and July, August, and really peaking there in August and September, and start to then decline in October, November, and December. Indicating a lot of different things. This tells us a lot of different things as a scientist when we want to talk about a salmonella control program, or we as an industry want to be, to make sure where are we going to be more concerned, where are we going to be more heightened. But you see it's relatively consistent from year to year. If you see the different color lines, we may have years where things peak a little bit. You know, in 2018 and 2016, we had September was a rougher month with it being a little peaked there. And then you saw, of course, in 2019, we've had a little bit lower of a prevalence there in September, but it still demonstrates some of the complexity that we see with salmonella. It's not the same things that work in one month may not be the same tools we can use the next month. So we really have to get a program that is really tailored to the unique needs we see with salmonella, which again is why I say it's important to know of the 52-week window you're looking at. If we know there are certain periods of time where they tend to be a little more higher amount of salmonella, we can focus more resources there. We know it might be not as great of an opportunity to have a good record for us when we're evaluating where we may lie on a performance standard basis. Next slide, please. And so you hear a lot of talk about Salmonella serovars. And so if I take that same data set that I just showed you guys that looked at prevalence, I take that same period of time from June 2014 to June 2019, and I say, okay, well, how can we tackle, because we've all heard all salmonella is created differently. You know, not all salmonella are created equal. So how do we tackle, or what characteristics of salmonella can we really look at to try to drive down the salmonella that you're seeing and make an impact on public health. This slide just shows to you and demonstrates the extreme complexity and variation we see in the range of just the overall salmonella. So we see the vast majority of isolates, not even the majority, sorry, the largest piece of the pie when it comes to salmonella, as we see Montevideo as the most common salmonella positive for ground beef samples. Then you can see Dublin, München, but you can see go around. We have over 100 different Serovars that were isolated from ground beef products from June 2014 to June 2019. So again, it's not very simple because each of these Serovars have different characteristics, whether it be different growth and death temperatures, whether it be how fast they grow or how slow they grow at specific temperatures. It has to do with their heat resistance, their acid resistance, and so it's very difficult to establish a food safety program for challenges like salmonella, which are so complex and so different. And so I think that this slide is really helpful to put it into perspective of we think of salmonella sometimes as just one pathogen, and it's very, very unique pathogen that you see. It's extremely, extremely diverse. And one of the most interesting things that you see is you'll hear a Serovar pop up as being a concern, and then you won't hear about it again. You know, you can see Newport. We had some very large salmonella Newport outbreaks in the ground beef industry not too long ago, and only 2% of the positives ended up being Newport. And again, you see Montevideo at 22%. But knock on wood, we have yet to have a Salmonella Montevideo outbreak associated with beef. So that can speak to the complexities. You have one Serovar that rises to the top, yet we don't see the same public health concern. And determining why that is again part of the mystery and part of the exciting field for food safety research that we really try to zero in to help improve public health. Next slide, please. So here's another example. If you take FSIS's sampling program on the MT60 program, or beef trimmings, and compare them to ground beef, and you see what Serovars are common in trimmings and what are common in ground beef, you don't always see the same ones. So this slide, if it looks like a mess to you, it's supposed to, because it just helps demonstrate the complexity. You see Montevideo keeps its #1 spot in trimmings as well as in ground beef, and you say similar with Dublin. But then again, you look at Newport, and you see Newport is the 3rd most popular Serovar we see in trimmings, and it doesn't even make the top 10 though by the time you get to ground beef. And so you can go through and see where Serovars sometimes move up versus move down, and that can speak to sometimes how they survive throughout the supply chain, and again how at different stages in the meat industry or different stages during packing and processing we need to be looking at salmonella differently. On both these columns, I talk about the number of positives we were looking at in that same time period, as well as the number of different Serovars that we saw as well. Next slide, please. And one thing I would be remiss, we did a deep dive on beef, but I wanted to at least mention pork. We do have an upcoming performance standard for pork as well. We know it's going to come sometime this year. We don't know what it's going to look like, but when it releases, they will also release results from the Pork Exploratory Survey, which is going to give us a good idea of where the agency or where FSIS saw salmonella throughout the pork supply chain. And so we know that we're going to have performance standards on pork parts as well as pork ground products. So indicating that's where FSIS probably found more of its positives, and some of the preliminary data have indicated that's where they're finding more of the salmonella. And so we'll be looking forward to that later this year to see what that proposal is and the risk assessment done by FSIS there. Next slide, please. And I would be remiss if I didn't mention, you know, the North American Meat Institute has a sister organization that's a separate organization called the Foundation for Meat and Poultry Research and Education. And again, it is the research arm of the meat industry. We fund quite a bit of food safety research, many that target Salmonella, E. coli, Listeria. You know, we run the whole gamut, and more than happy to share with you. Please visit our website if you have some questions on, you know, what give me more, what specific things are you worried about, or give me some resources on food safety, particularly that, you know, we're providing industry, or what is industry focusing on that fits like a puzzle piece next to some of the work that the partnership is doing. And we are also a contractor to the Beef Checkoff, so we have numerous resources funded through Beef Checkoff, including validation literature review databases and a number of other different things. And we also have a mailing list where we share our most recent research findings. And if you're interested in getting on that mailing list, please email my colleague Susan Bacchus, and her email is on this slide. And with that, I believe I'm passing it back to you, Shelley.
Thank you. Thank you, KatieRose, and thanks for those great links, because this group is very curious to get more information, so that's very helpful. Thanks very much. I wanted to talk a little bit about consumer research, and then when we look back to questions, we'll probably talk a little bit more about some of this presented by Ashley and KatieRose. Really interesting. I've learned a lot already on this. So on consumer research, I wanted to just talk briefly about two things. One, USDA is about a little more than midway through multi-year observational research, and I'm going to talk a little bit about that, and then I'm going to briefly talk about some other observational research in which safe recipes, or recipes that include food safety prompts, improve thermometer use. So USDA FSIS, the Food Safety and Inspection Service, contracted with RTI International and its subcontractor, North Carolina State University. They conducted meal preparation studies to evaluate consumer food handling behaviors in a test kitchen. It's part of a larger 5-year study that also includes focus groups, as you see here, and web surveys. The data describes results of meal preparation study that examines consumer use of food thermometers when cooking ground turkey patties. This is from year 1. This is when they focus on that. Again, this is brief overview of the 3 years that are completed in this study. And at the end of the webinar, there's a link to get all of their research studies. A lot of interesting stuff there. So what I'm talking about today really is what they did with the preparation of ground turkey patties. So in this study, in meal preparation, before preparing it, a randomized treatment group watched a 3-minute USDA food video titled "The Importance of Cooking to a Safe Internal Temperature and How to Use a Food Thermometer." So key findings there, of course, were that the video use immediately before food preparation did encourage participants to follow recommended use of a food thermometer to check for doneness of the raw poultry. So they were twice as likely to use a food thermometer, as you can see here, as the control group, 75 versus 34%. Participants in the treatment group were twice as likely to place the thermometer in the correct location. And as you see here, they also looked at the correct placement and checking more than one patty. I thought this was interesting that in thermometer users, as you see, which the video helped them with knowing the correct temperature, but with a temperature, an endpoint cooking temperature of 165, we love to see the 73%, and I do wonder how many overcook them. So that's probably in the data too. So I thought this was interesting to see that even without having seen the video, those who did use a thermometer, about 54% cooked to the safe temperature, where 24% did not. Research that is the background of the safe recipe style guide, I think is important for you to know about, because this goes to the power of providing the food safety prompts and recipes. And the use of thermometers improved dramatically when people were given a recipe that included food safety instructions, as you see here, from 20% to 86% use of the thermometer. And this again was for a turkey patty, ground turkey patty. So those are important things to know about grilling season. You have the option in promoting your grilling season to really talk about using a food thermometer and perhaps consider recipes as a tool. So a little bit too to highlight what our Don't Wing It campaign talks about when it comes to handling poultry safely. It gets into the shopping, the sort of in-store environment, as well as the home environment. And you know, I haven't really thought about, in light of all that's going on with the shopping environment and why it's so different at present. These are still best practices, including the use of the plastic bags. This was a big part of the study. They did swabs, they did testing, and really found that the use of the plastic bags at the grocery store and keeping the raw poultry in the plastic bag until the point of either freezing or preparing did have some impact on cross-contamination in the kitchen. So more about this at Don't Wing It. But as you see, these are the main messages for consumers about handling of poultry. We have a great flyer at fightback.org, and we call it the science behind the messages. So it really gives you, in very concise terms, what is the science behind the things that are best to say to the consumer about reducing their risk of foodborne illness from raw poultry. I'd encourage you to go to fightback.org and check out the Don't Wing It campaign. We also have a short video that, it's a very short video that literally shows handling of a raw poultry product from the store to home. And that could be something you want to share during the grilling season. We have English and Spanish printable items from our website also on handling of chicken. And everybody loves chicken. Chicken is a big seller. As Ashley will probably know more detail on that. But we also find the safe minimum temperature chart in it, whatever format you want to provide it. Consumers love these. They love it. So we have a couple of different charts. Here's one you can download that's super simple. Consumers like to have these during grilling season. It's a popular piece. We have put together a little cluster of our safe recipes that are grillable. As you see here on the right side, you'll see thumbnails of these 4 recipes. We have 5, I think, we're offering. So we wanted to just separate them out from the rest of our safe recipes to show you some that you can use during grilling season. This is, again, a recipe where there are prompts built in, very short, about handling of meat and poultry for safety by the consumer at home during this great grilling season. As we begin to wrap down here, I would not want to not mention the USDA Meat and Poultry Hotline. Fantastic resource for consumers, for you. They've got answers about meat and poultry safety, not just consumer handling, but other things that might be helpful to you if you're in food service. Very popular at the Thanksgiving holiday, but also during grilling season. So with that, we're going to move into some questions. And we did have a couple questions already come in. So I want to start with one of them because I think after you've seen all the information about Salmonella, a lot of people are curious about this. So I actually think KatieRose and Ashley, both of you might want to address this or have a dialogue. question is, can you help explain the significant change as it relates to the Salmonella serotypes? They're looking, I think they're getting this from the CDC chart I showed. The I4512 I minus, or I guess that's 14512 I minus, and Infantis. What do you explain that fairly big leap we see from the CDC data in FoodNet on those serotypes?
Well, this is Ashley. I'm happy to go first and talk about Infantis. You know, as I showed on my slides, back in 2015 and 2016, Infantis was really not even on our radar screen as an industry, and it wasn't until the end of 2017 and into 2018 that it became a serotype of interest for our industry. And of course, then as I talked about, we had the outbreak associated with Infantis. I think one thing to be cognizant of is as we look at that data and that chart, that compares 3 years of data to one. So you've got 2016, 17, and 18 compared to one, or to 2019. And as I mentioned, in 2016 and even most of 2017, Infantis wasn't on the radar screen. And then, you know, you can go from 2 to 10, and that's a 5-fold increase, which is going to make people be very concerned, and rightfully so. But there are a lot of things that influence shifts in serotypes, and whether that's intermittently used on the farm, whether that's vaccination practices, whether that's a new serotype that gets a plasmid that now is a little more aggressive and can knock others out. We always see these shifts, and so I don't think it's any surprise that 1 or 2 go up or down, because nature loves a vacuum, and Salmonella, as soon as you get rid of one, another one's going to take its place, and that's just the nature of Salmonella that we deal with. KatieRose, do you want to talk about I4512 I minus?
Yes, absolutely. Thank you, Ashley. And I echo a lot of what Ashley says, and tried to illustrate in some of my slides the complexity we see with comparing Serovars across time, and specifically with I4512 I minus. You know, it really wasn't on the radar. Nobody had heard of it at all. And then we had a pork outbreak in 2015 where it really put it on the map, and it really started climbing, and it gained a little bit more of additional virulence characteristics, making it a little more easy to survive in the environment. It became a little more harmful to human health. And then we start seeing it pop up a little bit in other food commodities outside of pork as well, when again, it wasn't even a focus on the radar. And really since 2015, we see it some, but not to where we saw it then. So you'll see the numbers have changed there, because again, for the most part, our culprits or specific Serovars change vastly from year to year, and that's part of the whack-a-mole that we have to deal with.
That's a good, that's also a summer thing, you know, go to the fair and do the whack-a-mole, win a big teddy bear. I'd also like to ask you both to just say a little bit about this idea of the spike in the summer. You know, you briefly touched on it, and I think for educators, it's something, you know, we always want to address. Back in the day, everybody was like, you know, picnics, it's potato salad, but what would you say about the spike that's useful to people who are trying to talk to consumers about taking actions to reduce their risk?
I'll start with this one, Ashley, and let you go. I'll take the first one on this one and let you go second. What's important from the seasonality of the data I showed, that's product data. So that's not clinical illnesses, or that's not incidents of people getting sick. That's what we saw in actual product. And there's a number of reasons for that. You know, Salmonella can live in inside environment. And again, that was with ground beef. And so cattle, for the most part, are raised outside. So pathogens that grow in hot weather more than in snow. And so there's going to be just some basic environmental changes you see with that, that can then be carried forward into the product. There's more of it. That means when they come into the plant, it's more that we have to knock down that we didn't have to in January. But with that being said, is the same food safety practices we suggest of cooking things thoroughly, washing your hands, not cross-contaminating, still hold true 100%. And so those safe practices are just even more important, and especially in the summer months where you want to have your friends over when you're not in the middle of a viral pandemic and having a barbecue where you could potentially get more people sick than what you normally would if you're just cooking for yourself. It's super important that we follow the right food safety practices of keeping it cold, clean, and keeping it moving. The excellent work that the partnership does is even more important during those times.
Yeah, and thanks, KatieRose. You set me up well. I think I would also add to that that while over the summer we are having social distancing picnics, that it's also important to use a food thermometer. Chicken needs to be cooked to 165. So if you are making chicken for your guests, please use a meat thermometer. And Salmonella is seasonal. The outbreak that I talked about, the Infantis outbreak specifically, we did see an increase in case patients in the summer months, August in particular. And is that related to improper handling of product? I don't know the answer to that. But again, Salmonella does have a seasonal effect to it. But to echo KatieRose's excellent comments, it's always important to follow the basics. Food safety practices in the kitchen and on the grill.
Thank you both. And we actually have some graphics that we'll maybe link to in the follow-up email here called Summer Without Salmonella. And it gives you some graphics of different protein types. And as the two of you pointed out, it's across different commodities. So this summer, we can all make a commitment to really fight Salmonella and help the consumer do that too. Okay, we're going to look here for some additional questions.
So we only have a few minutes before we wrap up this webinar. So if you have any further questions, please send us an email at info@fightback.org. Next slide, please. We also invite you to join us today at our YouTube event, Some Like It Hot, Grilling Alone Together. You can join us today starting at 2 p.m. Eastern to see a variety of safe food handling videos. And also at 3 p.m. Eastern Time, Janice Lopez Munoz from USDA Meat and Poultry Hotline will be taking live consumer questions, and feel free to join us there and submit questions there also. Next slide, please. Please take this quick poll for us. It asks, which service have you relied on the most during the COVID-19 pandemic? If you could please take a few moments to answer this poll question for us. Okay, about 5 more seconds with the poll. Okay, it looks like the majority of the folks on the call have not used any new form of receiving food via services, but 39% say that they have done grocery store pickup or shopping at a community corner store. Thank you for participating in the poll. We'd like to thank our partners this year. We have 4 Tier 2 PFSE partners, and without their support, we wouldn't be able to provide this webinar and other free resources. For a full list of our partners, please visit fightback.org. And many of you are probably wondering about your continuing education units. This is a final reminder that you can download them now from the sidebar. We will also send a follow-up email within the next 24 hours, or you can wait until tomorrow afternoon and download them from our website, fightback.org. And thank you so much again for our speakers today, Dr. Mindy Brashears, Dr. Ashley Peterson, Dr. KatieRose McCullough. Thank you so much. We really appreciate it. And here's some other research for you all from the USDA. And also, World Food Safety Day this year is on June 7th. We really would love to recognize the important people who keep us safe and fed right now: grocery store workers, frontline workers, people who are out there just trying to keep us healthy and safe with our meals and groceries. So if you have anyone that you would like to recommend to us, please visit foodsafetyday.org and tell us about your food safety hero. And here's some more research data for you. And we thank everyone so much for attending our webinar today. We invite you all to join us on YouTube right now to get your meat and poultry questions answered. Thank you so much from the Partnership for Food Safety Education. Everyone have a great day. Be safe.